age associated changes in the drug absorption. The difference in the GAT from young. In adult, there is decrease in the parietal cells that leads to decrease in the gastric acid secretion. And if the gastric acid secretion is decreased, that leads to increase in gastric acid pH. If the gastric pH increase, it means the basic pH. And normally, the gastric pH should be acidic. How it affect? If the gastric pH changes from the acidic to the basic, the drug that dissolve in acidic medium will not able to absorb. This is the one reason. The gastric pH should be acidic. But a person to decrease in the parietal cells, there is decrease in gastric acid secretion and the pH is become basic. So this is not good for the acidic drug because acidic drug requires acidic environment to the dissolve. Second one is decrease in the peristalsis moment. How it affects in the elder? Decrease in peristalsis moment, it will affect the gastric emptying time, and this gastric emptying time is responsible for the changes in the therapeutic effect. Decrease in surface area for absorption. How? The intestinal mucosa, due to intestinal mucosa atrophy and decrease in the number of villi, the surface area for the absorption will be decreased. In simple logic, greater the surface area, greater the absorption. Smaller the surface area, smaller the absorption. And in the elder, in the intestinal mucosa, due to atrophy of the intestinal mucosa and the decrease in the number of villi, the absorption of the drug get decreased and decrease the blood flow to the GIT. Increase in the blood flow because blood acts as a carrier vehicle for the drug to transport to tissue and organ. If the blood flow is decreased, obviously the drug transport to the other tissues and organs will be decreased, and that affects the therapeutic effects. So these are the four important factors that affects the absorption of drug in the elderly. In addition to this, in elder person, there is decrease in the liver mass. And we know that liver is the factory for the metabolism of the drugs. Decrease in the liver mass, decrease in the liver blood flow, and decrease in the activity of metabolizing enzyme. And these are the from the family of cytochrome P450. Now, if the liver is the factory for metabolism, so the enzymes are the labor to get work done to metabolize the drug. In older person, there is decrease in the liver mass, decrease in the blood flow to the liver, and decrease in the activity of metabolizing enzyme. These are the three important factors that affects the metabolism. And if there is a no metabolism, no excretion, the drug will build up in the body and leads to toxicity.